Here's how to beat pain in less than 2 minutes for the physician during an office visit. I want to keep these things as brief as possible. So I'm going to start with, let's start with always thinking I'm going to do the twist and the arm raise with the patients that walk through the door. Here's what the twist looks like. Have them test left side versus right side. Their neck doesn't have to go along, or their head doesn't have to go along with them. Test that. Put their hands on their belly and don't let them move their hands from their belly. Gives more of a pure good. Left side's a little bit more difficult. Alright, if they're having trouble telling, you simply say to them, look, if you had to push that way for 2 hours or that way for 2 hours, which one would you dislike more? I dislike that. I am going to now twist for 20 seconds. Think about twisting from my lower belly and my back, from that angle, from my chest, and then twist from my shoulders. And then I repeat that process. I do this for 20 seconds. If my leg gets caught up, I just kind of let it drop down. If it gets tight. And I'm going to do this for 20 seconds. There's no such thing as cheating on it. Just get them to rotate. You're going to stop. You're going to do it one more time. The rest in between isn't important. Just, give them as much time as they need. For the twist, it's usually like 10, 20 seconds. Do it again. All right, when you get done, retest your twist and then retest the issue. For example, if they came in and they couldn't lift their arm up, retest that. See what it looks like. All right, so I like to start at the twist because it's because of the spine. The next one down this realm is the arm raise. So go ahead and have them test the arm raise. And what we like to tell them is to keep your bicep by your ear. Don't try to bend your arm. Reach to the ceiling, pull it back. Come over here, do that. Oh, a little more stiff there. And then this is the way we treat that. Reach up to the ceiling, back. Up to the ceiling, back. And I don't just reach with my fingertips. Reach from the shoulder and back. Don't put so much strain on your, pulling with your fingertips puts the strain on your shoulder. Just pull up from the shoulder, back from the shoulder. Up from the rib cage, back from the rib cage. And let your head go where it wants to. And you're going to do this for 2 sets of 20 seconds. All right, notice how I'm keep going back and up further and further and further each time. I'm going to do it for 2 sets of 20 seconds. When I get done, I'm going to retest the bad side. And I'm going to retest my issue. Maybe it's shoulder abduction. Fair? Now, some of you may say, well, can we start off with shoulder abduction and just do it instead of forward flexion? Absolutely. Now, have a look around the website. Notice there's something called the Orthopedic Blog. That shows you about a guy who uses these 2 exercises for almost everything. Whatever walks through the door. Go on and look at the research that's been done. As far as the concept of this technique is being used all over the place.